Cancer is one of the leading causes of death worldwide, and nearly 10 million people lost their lives to cancer in 2020 alone. Colon cancer is one of the most common, with over 101,000 new cases reported every year in the U.S. One study shows that the age of diagnosis is getting younger, with more people in their 20s and 30s testing positive. Today's video is all about early detection and what you should be on the lookout for. Let's begin. First, nausea is a common yet vague sign of colon cancer. Your body gives away several signs that something is not right. One of the most common ways for your body to react against illness and discomfort is nausea. If you feel nausea and vomiting for an extended duration, you should not ignore it. Colon cancer could cause obstruction in your bowels. If there is a tumor and it is caught early, then you can stop it before it spreads to the rest of the body. Next on our list is fatigue. Most people ignore subtle warning signs like constant tiredness, chalking it up to stress and a busy lifestyle. While it is true that your lifestyle could make you feel tired, chronic fatigue still should not be taken lightly. It could be an indication that your body is struggling to fight a cancerous tumor. The tumor causes blood loss in your stool. While you may not have found indications of the blood in your stool, the constant fatigue means there could be a tumor. When you lose blood, you would also have an iron deficiency that causes the fatigue. Since there are fewer red blood cells, your organs don't get the supply of oxygen that they need for the body to function optimally. The next sign is bleeding, specifically rectal bleeding. When you notice bleeding in your stool, you should immediately consult your doctor. The blood's color could either be red or dark maroon. Bright red-colored blood means it's fresh, and there's something wrong with your lower digestive tract, while dark maroon blood is actually digested blood that indicates problems with your upper digestive tract. The bleeding could be from other causes, such as hemorrhoids or an injury in the area. Bleeding due to colon cancer would be in much larger amounts than is normally the case with hemorrhoids. Finding blood in your stool can be an important indicator of cancer. People tend to ignore rectal bleeding because it can be intermittent. It can happen one day and then will not occur for a few weeks before showing up again. A low hemoglobin count, or anemia, could be a sign of colon cancer. Losing blood through stool is usually because of colon cancer tumors. There is another way to figure out if you're losing blood as well. When you bleed from colon tumors, you lose a lot of blood. This can cause an iron deficiency in the body, but a routine blood test can show if you have anemia. Anemia is the result of a decrease in red blood cells. This can happen for many reasons, including bleeding from colon cancer cells. If you don't have the right amount of healthy red blood cells, get yourself checked to see if you're losing blood due to a colon cancer tumor. Unproductive bowel movements is another signal. The feeling of wanting to clear your bowels but being unsuccessful is a condition called tenesmus. Tenesmus happens when you have a tumor in your colon or rectum. Another sign is narrow stool. Take a look at your stool to see if it's more narrow than usual. You can only determine your stool has changed if you keep track regularly. Other indicators include changes in bowel movements. Constipation could be another indication of colon cancer. Constipation can be another sign something is wrong with your colon. Constipation can be caused by many things. One of the main reasons could be a lack of fiber in your diet, but usually it does not last and can be fixed by upping the fiber in the food you eat. But if the constipation lasts for a long duration, it could be a colon tumor. If you continue to have constipation for a prolonged period of time, it could even increase the severity of colon cancer. Frequent abdominal pain. If you have colon cancer, one of the signs is abdominal pain. This is because the tumor will have caused a blockage or tear. You'll likely face cramps or other types of pain that can be very uncomfortable. When your abdomen is tender or suffers sharp pain, that's usually a sign of a tumor. The pain is because things are not passing through freely as they should. There's a blockage that's causing the cramps and pain. You would also likely suffer from nausea and vomiting. You would have swelling in the abdomen due to the tumor. Timely intervention will reduce the chances of the tumor spreading. Unexpected weight loss. If you are experiencing a sudden drop in your weight, along with any of the other symptoms, you need to get a thorough checkup. Colon cancer can cause weight loss. Weight loss in general is a big giveaway that something is wrong with your body. Cancerous tumors can cause problems in the way your body functions. The tumor can stop your body from absorbing all the nutrients. It also stops your body from being able to use the food the way it needs to. Because of this, you might not have enough energy. Your body then starts using its reserves, causing you to lose weight. The body usually gives you warning signs when something is going on behind the scenes. Did you know what these warning signs meant before watching this video? Let us know in the comments below.